Saturday the 4th, February 2012. You tuned into Living. How are you guys? How was the day? How was the week? I'm sure it was great, and we're living, and that's just about one more day, one more week. The last few weeks we were talking about a sexually transmitted disease. We're gonna wrap things up. I wish all you guys good Saturday, but I want to start this Saturday real nice for you. We got two wonderful gentlemen in the house. We have David and Cory, and they advocate for HIV and sexually transmitted disease and how you can prevent this stuff. So call your friends, call your neighbor, and sit down and listen to us. We've got some facts for you, the children too. All right, guys, this is going to be a call-in. You're going to call in and speak to David Browne and Cory Lane. We're here to talk to you about how David going to talk to you about how you can prevent yourself from having sexually transmitted diseases. And Cory is an advocate for Live Up, and he's going to tell you about HIV and all of those type of statistics and all those things you need to know. You can call us. Our number is 424-1791, 424-1790, 424-1771. Don't forget 424-1791. Call us. We'll answer your call. This is your program. You got any questions about sexually transmitted disease? We talk about salt. Last week, sex at lunchtime. I'm going to ask you a couple of questions. You can call in. We've got two gifts for you. Two packages for you in a nice bag. David, what's in those bags actually?
In our gift packs today, we have Lifestyles Skin Condoms, Lifestyles Vibrating Ring, and Lifestyles Warming Lubricating Gel.
Good, all things to make you enjoy sex.
That's right.
Safe sex in a nice, fashionable way. People think that if you have condom on, you don't enjoy the stuff.
Exactly.
But it's crazy. Yeah. And then remember, they skin to death. So don't forget, 424-1791, 424-1790, 424-1771. Call us. I got two questions for you. If you answer these questions, you'll get this wonderful, two gifts for two people actually. So answer the questions and you come here and pick it up. Wonderful lifestyle condoms and the ring and all of those nice things to make sex pleasurable for you. Let me give you the two questions. One, give the name of one sexually transmitted disease that is virus in origin, a viral sexually transmitted disease. Don't talk about HIV. We know that's a big one. Give me another one. And the second question, give me a bacterial or a sexually transmitted disease caused by a bacteria. So one caused by HIV, a virus actually, and the other one caused by a bacteria. If you call and give us any one of those pathogens that can cause sexually transmitted disease, it means you were tuned into our program and you know what's going on, and we'd be happy to give you these wonderful gifts. You'll come to Starcom and pick them up. So don't forget, you call us 424-1771, 424-1790. We talked about chlamydia, gonorrhea, genital herpes, syphilis, HIV, trichomonas, pubic lice. Yeah, I got a few people ask me those questions about the pubic lice and the scabies, itching and so forth. You have sex with a young lady or a young lady have sex with a male and find that they're itching and you don't know what it is. No discharge, but you're itching. Oh man, I got these lice that like to hang out on the pubic hair. I don't know why.
It's cooling out lately.
Could you believe this hanging out there? You can't see them, You just can't see them, but they're there. So all of these sexually transmitted, and hepatitis too, a lot of other things. Papillomavirus, I want a woman to be very, very concerned about that. It's basically, it can cause cervical cancer. What's your experience about it? You have experience with that, Cory? HPV?
Well, in the presentations we do, we talk about all those sexually transmitted infections that you spoke about just now.
Is that so?
That's the extent of my experience. I never had human papillomavirus as far as I know.
Yeah. No, but you know, people, some guys fool their young ladies and say, I got 3 calls there right now. Let me take one.
Good morning.
Good morning.
Gonorrhea?
Gonorrhea. Perfect. What type of is that bacterial? Is that viral?
It's bacterial.
Parasitic? It's bacterial. You got it. We'll put you on hold. We get your name and you come and pick it up right here at Starcom. You just won. Yes, gonorrhea, bacterial, sexually transmitted disease. Thank you, sir. You on the air? Good morning.
Herpes.
Herpes. Very well. What type of?
Viral infection.
You see that? We got a second caller. Yes, herpes is another viral infection, sexually transmitted, of course. That thing don't go away, for one reason, we're able to kill bacteria and intercellular parasites and so forth. But viral, we don't have much conquer over those things. Virus have really dominated. You get herpes virus, it stays around. It comes and goes like the HIV. Thank you, ma'am. We'll put you on hold and then we'll get your name, and you'll be able to come and pick up that package right here at Starcom. Okay? Thank you for calling. Don't hang up. Yes, so everybody knows what's going on. So virus, don't forget HIV, papillomavirus, and herpes virus, and the bacterial. We have chlamydia. We have gonorrhea. Think about other things like parasitic pubic lice, scabies. Trichomonas is a parasitic. If you want to think about hepatitis B, also is a virus. So those are sexually transmitted disease, guys. That's a lesson for today. But call us and talk to Cory, talk to David about, so what do you guys think about generally, what do you think is the most common in the United States, the most common sexually transmitted disease, chlamydia? What's our experience here in Barbados?
I think Dr. Tanya was saying the evidence suggests to her that that's the same thing here. I will have to ask you, if you come across a lot of patients or people in the day-to-day talking about chlamydia, because they understand chlamydia is supposed to be number 1 and gonorrhea is supposed to be number 2 here in Barbados.
Yeah, you see,
number 3.
And number 3. Yeah. But you see, the thing is with those guys like to hang together.
Yes,
we as practitioners, what we normally do, thank you, like to feed on each other. What we normally do, if you got gonorrhea, or you got clap, or you got a leak, as they call it in layman terminology, we normally would treat you for both, all right? But chlamydia is extremely common, but what happens, it's asymptomatic. A lot of times you don't even know you have it.
Right.
You see, and that's why women, if they have chlamydial infection, a lot of them get pelvic inflammatory disease, which is a disease that destroys the whole GU system, and a lot of them become infertile and so forth. So, but chlamydia, man, bad. And men sometimes would carry this thing and don't even know about it at all. But some people may have discharges and so forth. It's very, very...
That's why, like, when you encourage callers last week, if they find that they have a particular infection, they'll go and get their partner tested as well, because it makes no sense, getting one getting tested and not the other.
I agree. So, yeah.
I have a question. Why is it that we know that chlamydia is so high on the list, but it's never highlighted? We always concentrate on HIV and AIDS. And we briefly talk about STDs, but nobody talks about chlamydia, nobody talks about gonorrhea. And even hepatitis. Isn't hepatitis extremely contagious?
Yes,
one, and deadly?
Yes, it is. It is. People have a tendency of focusing, having their focus actually built on things that are very, very, would kill you. The HIV is going to kill you. Yes, they're going to talk about that. Chlamydia, big deal. You get a couple of pills and you'll be okay. So they can't do anything to you. So they put in the back burner. But yes, all these things have long-term effects on you. We got a caller?
Good morning.
Good morning, ma'am.
If you have Parkinson's disease, what it does for you.
If you have a what?
Parkinson's disease.
Oh, Parkinson's disease. Yeah, that's... Well, actually, some people, it's just a disease in the brains and the neural, or the neurons in the brain, or the brain cells, actually, when they become very old and dysfunctional. Certain areas in the brain, and then you find that you have all type of movement, involuntary movements of your hands and your feet and so forth. It normally is a process in aging, and some people it occurs earlier than some people. But normally, most of those people, their function, or intellectual function as they go on in life, deteriorates, and they become forgetful and so forth. But it's a part of the aging process, ma'am. Some people are affected more than some.
There's no treatment for it?
Well, there's some medicines you can get that can really attenuate the whole thing and make you feel better. Aricept and a lot of medicines we can use help you out. But basically, no, there's no cure per se. But, we just help the symptoms and so forth. Thank you for calling.
I want to continue by answering David's question. One reason that people focus on HIV, right? Number 1 is a very sexy topic, and number 2, that's where money is. A lot of people go after that donor money, and a lot of donor money is put into HIV. But I agree with you, because a lot of these sexually transmitted infections makes the body more susceptible to HIV at the end of the day. But nobody talks about these things. I was so shocked at the time I was doing a presentation in prison, and we were talking about crab lice and so on, and people were talking about they don't have it because they can't see it, not knowing that it is 0.4 millimeters, the biggest one. And the funny thing about it is that generally people would not want to talk or disclose, but we had a very open session, and people are saying, whoever had this virus, whoever had that virus, and I myself was shocked, because people were saying, man, these things don't exist because we don't talk about them, and probably don't talk about them because we feel they don't exist. And what was so shocking is, I tell myself, I'm going to ask who have these particular viruses, and I said about 1 or 2 people can put up their hand. About 8 or 9, 10 people put up their hand per virus. And you understand? And even me myself was shocked at that, because we don't talk about it so much that I believe, it's just a 1 or 2 thing. But nobody walks around with a sign saying I have a virus. You'd be surprised how many of these viruses that we're talking about that people out there walking around with.
Exactly. You have even the herpes virus, right? You find what happens a lot of times when you're stressed out, it comes out. Now, when you're stressed out, it'll come out, but normally it comes up in one position. You look at somebody and you see they have a little, small little crusting stuff in their mouth, and it appears the same spot all the time. Same thing in the vagina. And it goes away, and in a year, 2 years, you may not see it, but it's hanging out in the nerves. So this stuff is there. But people don't stress it a lot because, as I said, it wouldn't kill you. The HIV gets you.
What causes it to come and go? With stress? What?
Yeah, stress. When the immune system goes down, it just emerges. And then when you catch yourself back again, sometimes you can treat it with a little bit of medicines to get it back, attenuate, cause attenuate the virus and so forth. It'll go away. But generally, your immune system, when it comes down, it just emerges.
So you're saying to me that stress can cause your immune system to
yeah, of course. Of course. I mean, as a matter of fact, you want to see very stressed. That's why you think a lot of people, when they're stressed out, they get a lot of colds and all. That's and life is like that. It's not only the small invisible world. Whenever you're down, the enemy try to get you, it's the same thing. The immune system goes down, all this bacteria. I can tell you guys right now, if you take a microscope and look in your hands, you'd be surprised to see what's going on there. But it's only when the immune system goes down. That's why HIV, people, it hits their immune system and they get all type of infection you don't even think about. It's really crazy stuff. But the sexually transmitted disease, man, it's something I think in schools, everywhere we need to talk about it some more. And I want parents to sit down and talk to their children, because don't wait until they get the stuff and then tell them before they get sexually active. Because if you don't, in school, their friend's gonna tell them about it.
Correct. That is so true. Recently in a conversation, we were talking about STDs, and someone said syphilis is a disease from years gone by. It's, nobody hears about it anymore, therefore it does not exist. Is that true?
No, it's not. Before, they didn't have a cure for it. They didn't know what to treat it with. You see, so a lot of people died from this stuff. You see that end stage where you have flooding tissue falling off and stuff. Now, you get treated for it, and you're able to cure it. There's a cure for it. So you don't see that often. But before, it's just like all of the other illnesses. Before we got the answer or the antidote for that problem, it killed a lot of people. A lot of people were sacrificed for that.
That's why we want to push condom use every time. And a lot of people are using condoms incorrectly.
Hold on. I'll get you right back there. Who's that? Let's get a call. Morning.
Good morning, Dr. Sparman and Company.
Yes, good morning.
Good morning.
Now, for the past week, I've been thinking a lot about the SALT that has been added to the children's lunch menu. And I was also thinking that it's about time that we have sex education on the program, on the school agenda per se. And it will mean quite a few of us getting involved in that. Because apart from the teachers might say, but this is not a part of my curriculum, you understand? We can also think there might also be our teachers who know what to talk, but then of course again they might blush and they might get to playing the truth and all that sort of thing when it comes to the explanation. Now you find that there are people in the medical profession, nurses, doctors and social workers, they have seen about everything and heard everything. Nothing makes them blush, and you can't look on their face and read anything. And at the PTAs, you'll find that on the PTAs, in the PTA association, you'll find their doctors, their nurses, their social workers, and they're all those kind of people.
Yeah.
And
so you basically you think that we should step forward?
Yeah, we have to step forward.
Yeah. What do you think about schools? You think we should have a special subject based on these things?
Yes. And I'm not talking about the act of sex. I'm talking about sex education.
What do you think about that, Cory?
How to make the children understand that sex is not a toy and a favorite toy at that.
Carla, I think you're absolutely right, and you could be almost seen as a reverse prophet, because in 2004, the Ministry of Education introduced Health and Family Life Education, and it was intended to touch just on the topics you're talking about. But what happened is exactly what you said. A lot of teachers said, I'm here to teach geography, I'm here to teach maths. A lot of them blushed, and they did not want to teach it. No, they were saying, but to Earlston, when the ministry discovered only 10% of teachers were teaching the Health and Family Life Education, up to the day 2012, some 8 years later, the same thing is happening. What they're doing is focusing in on the housekeeping and so on, because it's supposed to be a whole family program. It's not just sex education, it's health and family life. So they concentrate on the family life as part of the health, and that is exactly what's happening. So I think we need to touch, because as we said last week, adults do not like to talk about sex, but the children are talking about it and participating in it too.
And they're learning about it in the crude, rude,
an incorrect way too.
Another thing is, we can't only involve the Ministry of Education, because we have to have their consent to put it on the curriculum. But there is where the Ministry of the Family and something else come in.
But Carla, I'm telling you, it's on the curriculum already. The name of it is Health and Family Life Education. But the teachers are, from what I understand, I'm not attacking any teacher, but from what I understand is that they're not focusing on what we're talking about this morning. They don't feel comfortable doing so.
Because don't forget, they're not really into this thing as an everyday subject like people in the medical profession. Because as I told you, as a nurse, and Dr. Sparman will tell you, nothing makes a doctor blush, because he's seen and heard everything, and that goes for other people in the medical profession. So we can have the PTA organizing among themselves. Of course, we need help. We need to have these people say it's okay to go ahead and do these things. But we've got a lot of retired nurses out there and retired doctors who I'm so sure social workers who will be glad to come in and do something part-time, a couple of hours every day.
Well, thank you. Thank you so much. Thank you so much. I think your point is well taken. We got 2 callers. Just trying to get a couple of callers. Hey, you on the air?
I don't want to give my name, but I want to ask, what is called prostate to swell?
Your prostate?
Yeah.
Oh, yeah. Well, as we mentioned a little earlier about the aging process. Normally, as you get older, your prostate increases in size. And some people, more than some, meaning that the cells just enlarge. Sometimes these cells get enlarged at the expense of becoming cancer, and sometimes it's just an enlargement. So there's no real cause of it, but it's a part of the aging process, and a lot of people get a lot of symptoms from it, where you have it encroaches in your urethra, and then you have urinary symptoms and so forth. But yes, as you get older, that is why we recommend having at least every year getting a prostate test or a rectal exam to make sure that's not enlarged, because enlargement can be associated with cancer.
And taking medication for over a year is all right?
Yeah, you should, because there's some medicines there that can cause shrinking of the cells and put you back to almost normal.
Tantalin, I take Tantalin.
That's fine. Another name, Flomax, but you can take that once a day and you'll be okay. Just make sure you get a regular exam once a year.
So if I come off of that for a month,
it'll get enlarged again. So you gotta keep on that for the rest of your life.
Oh, all right. Thanks, Doc.
It's a pleasure, sir. Yes, continue. You were talking.
Good morning.
Good morning. Good morning.
Good morning.
Yes, please.
Yes, Dr. Sparman, all the best for the new year.
Thank you.
Yeah. What you're saying is a bit right, but I was very careful who I had my child teach sex education with. It can be a danger. You have to be very careful on a very serious path on who would teach your my child sex education. Okay? And sometimes too, it's not good to roast children very early. You think they may go and experiment. You have to be very careful.
I hear you. You know your point. I'm going to let Cory answer that, but you know what? I'll tell you something. If you don't sit down with your 6-year-old or your 9-year-old and tell him, listen, there's something called sex, and you're not ready for sex yet, but let me tell you how this thing works. A lot of these things can cause X, Y, and Z. You know what? Yes. So yeah. Because what happens if you don't do it? The guys in school or the girls in school are gonna tell them it in a different fashion that may be harmful to them. Cory, what's your experience with that?
David was just alluding to it. They also see it on the computer. It's in the music and so on. I wanted to find out what was the caller's concern in terms of who don't you want to teach? What is your concern? Because you're masking. I want you to come on and tell us direct. What is your real concern?
Yeah, I don't know. I appear my mother, father, or guardian or who. So the person teaching this children exactly and tell me.
Okay, that's not happening now. Let's move on. What is your real concern in terms of who?
Who is teaching my child sex education?
What is your concern? You think that someone will teach them wrong, or what's your real concern?
We have a lot of prominent people in this society who are not very up to date, and I would think that some of these people might go overboard teaching for their own purposes. My child.
Oh, I know. I get it out slowly. I don't think we got enough time to fully drag it out of you, but I get it out of you slowly.
I have a fear about that. Okay.
But listen, in terms of what we're talking about in the classroom, these teachers go to Erdiston and they are trained to teach the children in health and family life education.
Stop there. These children are not God. They're not even spiritually inclined to somebody.
But the parents are thinking that you asking them to teach and not God either.
Pardon me?
You just said that you wanted the parents to teach them, right?
Well, thank you, sir. Thank you for calling. Thank you for calling. Somebody else in there? Good morning.
Hi, good morning. Dr. Sparman.
Yes, hi, good morning.
And Cory.
Morning.
What that gentleman should realize is that it's about relationship. You have to build a relationship with your child probably from the time before the child is born.
Well said.
So that you can input everything that is morally good within that child. Sometimes when the child gets to school and he's hearing things from the teacher, through sex education, there are things that the child already knows. But if he is so scared, he should make sure he has the real input into that child's life from the beginning.
Exactly.
Thank you for that input. Cory, you going to expound on that?
I just wanted to wrap up. Sorry, the caller had to go, but the thing is thinking like that. I know everybody have their opinion, we respect it, but it's thinking like that that's driving what is happening now. You shouldn't talk to them about it. But as I told you, we have had instances in this country on multiple occasions where 4, 5, 6, 7-year-olds going experimenting in bathrooms. Do not tell me that you don't want your children taught about sex. If people have to sell a shirt nowadays, what do they use to sell it? Sex. Sex is out there. Wake up and smell the coffee. Wake up and smell the coffee. You understand? I don't understand why people would think like that, but that's all I want to say. I think you expound enough in terms of the need to be taught.
Yeah, David, you think that normally would you advocate telling your 10-year-old child that he or she should not have sex, but if it happens, would you use condoms? Would you?
Most definitely. Recently, my nephew was dating a young lady. Mm-hmm. Apparently, she was having sex from 12. She had herpes at 14, and did not disclose any of this information to him until after the fact. Parents really need to wake up. We need to get into the 21st century and talk freely about sex. Sex, you can make it pleasurable. There are products out there to make it that way, but you need to be very, very safe. Because most young people are not talking about what they have. Okay? We're not going to start today, and I say to you, hey, I have herpes. Mm-hmm. No.
Mm-hmm. That'll scare you away.
Yeah, exactly.
They tell you after antisocial, after the fact. No, we got a 15 seconds, Cory. What's your closing statement?
I think that if parents are not comfortable about, and one of the statements made last year, are not comfortable about teaching their children about sex, that they can get the information online or whatever, get a DVD, get somebody come in and talk to them about it, and not just try to hide it away and leave it for the world to teach them. Because some parents are just not comfortable.
Exactly.
I think they need to learn or put the children in front of things and sit down with them and watch it. Listen to programs like Living.
Thank you. 50 seconds, David.
All I want to say is whenever you have sex or you think you're going to have it, use a condom. I am pushing Lifestyles, but use a condom. We want to make safe sex pleasurable. There are lubricants there, there's rings there, there's all the toys there that you need to make it that way.
Protected sex, thank you. I want to thank you for listening, and all of you callers who call in, we thank you for sharing your ideas, and this can go on and on. Thank you for listening. 9 to 9:30 every Saturday. Living. Today we talked about sexually transmitted disease and so forth. We talked with David and Cory. Cory Lee and David Browne. Thank you guys for coming, and I'll see you guys next week.